Medicine. Community medicine is a very important topic for us, and we will discuss introduction in 2 minutes. That is, what is community medicine? In community medicine, we shall discuss about health. Health, according to WHO definition, it is what? It is a spiritually, emotionally, vocationally, ecologically complete mental, physical, social well-being. So mental, social well-being, we will discuss from this term, that is what is well-being and what are the classification of well-being in present in the general community section. But two way, one is a subjective well-being, another is objective. In subjective, there is an MCQ comes that a standard of living and a level of living it comes under objective part of the well-being, and quality of life it comes under subjective part of the well-being. Okay, now we will discuss what is standard of living or objective part. That is, standard of living is that it is having two types of standard of living and a level of living. There are, if we classify that in level of living is commonly used in US language. Standard of living, that if we give an example that how much we should earn and how much we spend, that determine our standard of living. So standard of living is comes from our education, food, housing, income, all are comes under from the standard of living. And the level of living comes that is human rights, social security. These are the common example of comes under level of living. Then quality of life is determined by the happiness, satisfaction. These are comes under quality of life, and these are the subjective criteria. Then physical quality life index, PQLI, it measures our quality of life. Quality of PQLI index. PQLI contains three types: infant mortality, literacy language, life expectancy. Infant mortality worst is in case of 0 and 100 is best for quality of life. And another factor is IMR. It is a best socio-economic indicator that gives us life expectancy about 1 year. Then one term is regarding quality of life, that is human development index, that determine the birth of within birth of the child in the India. It having three component: life expectancy, mean year, and per capita income. You should remember this commonly asked in your short question or in a PIG entrance exam. Discuss what is the determinant of health. How health is determined? It is determined by the factors which affect health. There are mainly two types: external and internal factor. In internal factor, there is biological determinant, that is determined by through genes, organ homeostasis, physical determinant, plants culture. These are comes under internal. Then socio-economic determinant. This comes the criteria that are income, health status, having like anemia, TB, respiratory, scabies. These are comes under health. Then education for mother for development of services. These are the determinant, like socio-economic determinant internally, education of mother for development of a society. Okay, that is health services also affect our health. This also comes under the determinant. Immunization in health services, like immunization, family planning, nutritional supplement. These are comes under health services. Now indicator of health we shall discuss. What are the indicator criteria? That indicator should be a valid one, reliable one, and a sensitive one. What is valid? Means it is as long as it is always true for all type of condition. All type of condition it should remain true. Reliable means it should be a reliable one. It should be a sensitive one. It can sensitize the all type of condition. Then measurement of death, morbidity indicator, disability indicator, nutritional status indicator, utilization of health services, that is quality of life indicator. These are the common indicator used. And what are the characteristics should a indicator have? It should be a valid one, it should be a reliable one, and it should be a sensitive one. Now mortality indicator, that is it is a crude death rate indicator. There is the why it is crude, because there is no specific of death, and it is not a strong indicator in general data it gives. That's why it is used as a crude term. Number of what is definition, that is number of death per thousand of a population per year is determined the mortality indicator. Then mortality, infant mortality rate, that is how much society educated so that the infant mortality should reduce. So how we calculate number of 0 to 1 year birth, 1 year 0 to 1 year of age group of infant having death divided by total life into 1000, that is the IMR. Refers to the mortality indicator. It defines the maternal mortality, that is maternal health status, that is RCS. These are comes under this MMR. So here here how we calculate that number of death of a mother during pregnancy plus 7 days after a childbirth of delivery divided by total mid-year population, that is mid-year mainly indicated June to July month, into 1 lakh, that is MMR, mortality indicator, mortality maternal mortality indicator. This comes under RCH, and maternal health status, they are comes under this group. Okay. Now CFR is the case fatality rate, means it indicates the severity and virulence of the disease, that is number of death from a particular disease. Example like COVID-19, there will be CFR rate less. Why? Because there is more chance of infection to the population is more than the mortality rate. That's why it comes under decreases. Then rabies case fatality is 100%. You should remember that one clearly the rabies is declared as the CFR 100%. Then we shall discuss morbidity indicator. It is a indicator which contain what are the factors in affect morbidity indicator, that is incidence, means how much the new cases are appear on that particular area. Then that is new plus old, they are come together, joint addition. If 25 occur, like this is means in your class there is a 25 student, they some of them are contaminated before cold disease and some of them are contaminated now cold. That's why they, when we given prevalence, then both 25 students are comes together and they are present, totality gives us the prevalence of that disease in your class. Then attack rate, number of susceptibility, like the number of susceptibility towards that case will give the attack rate. Then duration of hospital admission rate, then duration of hospital stay. Like in acute, there is 2 days for remain in the hospital. That's given us the morbidity indicator. Then disability indicator is 2 type. One is event time, another is person type. In person type, there will be daily activity loss, mobility loss, no work, number of work days loss. But in event type, there will be number of days the person is comes all the daily activity he done easily, but do not go for the any work and he remain in the bed. That is the event type of disability. Event type of disability is calculated by Sullivan index, Daly, Qualley and Halley. That is Sullivan index is now come under in Halley. Halley means it is a type of index which full form is health adjusted life expectancy. That is a person who having a disability, he adjusted his life for a number of poor days adjusted due to the poor health. That is the Halley. Quality means quality adjusted life year. And Daly, it is most commonly asked, that is it contain both poor health adjusted as well as the life or year which is lost due to the permanent death. That is here DD means disability with premature death occur and disability also occur. Both are when means a person in our India there is a life expectancy is a 75 year. Okay, life expectancy is a 75 year, but a person who get disability in the year of 50, in the year of 50. So now if we minus, then it will be 25 years is now he should remain, but he get he get death on 60 years. Then how much remaining? 15 years. Both if we calculate, then summation that will be 40 years is go to the DD means Delhi. Okay, that is the both death and disability are contained in Delhi. So these are the indicator and index we will discuss.